We are in the throes of COVID-19, coronavirus, and the effects on all of our lives, which are about 100-fold. And I'm really happy to get a chance to talk about this and other issues because of the COVID-19 to Dr. Jonathan Winickoff, who's the professor of pediatrics at Harvard Medical School and pediatrician at Mass General Hospital for Children. Dr. Winickoff, good morning.
Thanks for having me on the show, Andy.
Hey, thanks for taking time to talk with us. How are you? Let's start with your well-being and how you folks at Harvard are doing. I have a granddaughter who goes to Harvard who doesn't now because she's home, but how are things at the school and at Mass General?
Well, we're really at a critical moment now when it comes to combating this coronavirus pandemic. Supplies and equipment are they're a little bit low, I have to say. And in our hospital alone, we have 50 COVID-positive patients in our intensive care units, many of them on ventilators. So It's pretty serious. It's pretty all hands on deck. I see patients every day. I'm being called into different clinics. It's, we graduated our Harvard medical students early so that they could be on the front lines to help us out. It's that serious.
What about equipment, protective supplies, masks, gowns, face shields, and things? Is that, as we hear, a real problem on the East Coast?
Well, we have to conserve what we have so that we have enough to get us through the surge that's coming. And one of the things that can protect us in that and protect the healthcare workers is making sure we keep people out of the hospital. And so one of the things I wanted to talk to you today about was smoking and vaping and what the public can do to stay healthy so that we can preserve as much space in the hospital for everybody.
As much as we're going through in Michigan, I mean, on the East Coast, New York, Connecticut, through that region, the one of the epicenters, and now Michigan, especially southeast Michigan, Detroit, and we're on the other side of the state, becoming an epicenter. And you're right, the smokers compromise their own health systems with smoking and with vaping, and that can be a real issue.
Yeah, we've always said, even before this pandemic, that it was so important to get people off of smoking and vaping for their health. But now, in the setting of this pandemic, the call to quit is all the more urgent. And that's because tobacco product use and vaping diminishes the body's natural ability to fight off infection. So that's for both young people and adults. It really makes it harder for the body to keep out the toxins and expel the viruses from the lungs. I, as a pediatrician, I look at situations and stories where, for example, we have this 22-year-old girl who was hospitalized, and her only risk factor was the fact that she was vaping. That really is a big cause for concern as a pediatrician.
Oh, for sure, because we are seeing stories of younger people in dire health because of the COVID-19, the coronavirus, and then of the so many, sadly, deaths. And they always say they had a compromised system. So are they speaking of whether it's a heart condition or whatever? It could be smoking in general.
That's right. I think that smoking and vaping does compromise the immune system, and so it puts you potentially into one of those high-risk categories where you might not have otherwise been in there. And so when we talk about, our capacity to care for each and every person, I guess one of my key messages is that, if you want to protect your own health, it's really important to quit smoking and vaping. But in the light of a healthcare system that's really strained, if you quit smoking and vaping, you might just be saving someone else's life, because then there would be one more available space for someone else.
Yeah.
So it's an urgent problem. I really want your listeners to take it to heart. And if you know someone who's smoking and vaping, try to help them get off of those products.
Dr. Jonathan Winickoff is professor of pediatrics at Harvard Medical School and pediatrician at Mass General Hospital for Children. There's no easy way for a smoker, we'll say, to quit. I mean, they are hooked. And so is there anything you can help them with, recommend to divert that and get them off?
Absolutely. So for one thing, there's a national quit line that's free for people to use, and that's 1-800-QUIT-NOW. And that gives you free counseling. It oftentimes gives you free nicotine replacement therapy as well. So, if you can't quit, it's important that you get a quit coach, that you reach out to your doctor, and that's for teens as well. Reaching out to your doctor can be very helpful. Talking to your parents, getting support however you can. In terms of if you're not able to quit and you're on a dangerous nicotine product like vaping or especially smoking, we want you to transition off that and get onto a safe form of nicotine, which would be nicotine patch and nicotine gum. If you use both of those together, then you have fourfold increased chances of quitting, and that's exactly what we want everyone to do right now.
And you're right. And then as you said, you're saving someone else's life, but let's face it, they're saving their own life potentially.
I think that we each can feel a little bit helpless during a time of a national pandemic like this.
Mm-hmm.
One of the ways that we can take control is to really make sure that we're doing everything we can as individuals to unburden the healthcare system, to protect our neighbors. And one of the ways to do that is to quit smoking and quit vaping.
Okay. And quit getting together, just virtual the stuff. And instead,
well, yeah, a lot of I just wanted to add, that this hand to mouth behavior of vaping and smoking is also quite dangerous. You're bringing the device up to your mouth. You do this repeatedly. You're touching the vaping device. You're touching the cartridge. You're touching your mouth and face.
mm-hmm.
And this really goes against the clear recommendations from the CDC and public health officials for how to protect yourself against infection.
Yeah, so many things to do, but you're right. Let's start with yourself and make yourself healthy so that you're not infecting someone else. Are you seeing out east and at Harvard and Mass General, are you seeing any kind of a flattening of the curve a little bit, or what are you seeing right now?
Well, we think we're still about a week to 10 days out from the surge. So this gives us a lot of concern. We've been preparing at Mass General Hospital for the past 2 months for this. We have the capacity to turn virtually our entire hospital into an intensive care unit. We hope that we don't need all of that space, but we're ready. And we are really looking to the public to help us out, social distance, and make sure that no one, if it's in your capacity to not add to that surge, please follow the instructions of your local health department. And, of course, do everything you can to get off dangerous tobacco products that could increase your risk.
Amen. And we're not needless to say, we're talking about the Boston area, the Harvard and Mass General, but talking about Michigan. Michigan is number 3 now. So the more you can do, the better off we'll be, and hopefully flatten that curve. Dr. Jonathan Winickoff, professor of pediatrics, Harvard Medical School. Dr. Winickoff, thanks so much. It was a pleasure speaking with you, and God bless you and best wishes.
My pleasure, Andy, and good luck to your granddaughter.
Oh, thanks very much. She wants to get back to school very soon, so if you could kind of wrap this up, this would be good.
No problem. I'll take care of it personally.
Okay. That's great. All right, take care. Thank you so much.
Bye-bye.
Bye-bye.